Welcome, everyone. We'll spend an hour talking about how to effectively advocate for child or youth with mental illness. My journey started about 12 years ago. It was all new, and 5 or 6 hospitalization later, I'm here to share my experience of total of 12 years and 6 years in a volunteering capacity. So what you see here in front of you is the purpose of the presentation, and that's to provide you with a parental perspective for advocating in children and youth with mental illness. I will be sharing my own experience. This is not meant to be advice, and I would like to encourage you to get involved. So you will see a lot of aspects of my volunteering that hopefully will speak to you. So about 6 years ago, I joined Family Council at Ontario Shores, initially as a member and recently as vice chair. I was representing Ontario Shores at OFCAN, which is Ontario Federation of Caregivers Advisory Network. And recently I joined OFCAN as the board member. So the question is, what is advocating and what advocating is not? Right in the middle of the screen, you see the origin of the word in Latin from advocare, meaning to add a voice. And it's very important that we understand what advocating is. We are representing the interests of our child and youth and providing comments about our observations and about their private life with us. We are the only continuity that they bring to the hospital and medical environment before, during, and after. We are adding a voice. We are not replacing the voice of our child. And it's important to do this with them. Advocating is not interference with normal services, and definitely not being disruptive or unreasonable or insisting on receiving more than it's required, demanding or hijacking. It's definitely not advocating. So there are different forms of advocating. I group them at home, at school, and in the community. It starts from an observation when you spend time with your child or youth and you notice that something is different. And then you notice something else, and all of a sudden there's a new reality. I would encourage you to collect this information, write notes, post questions, and gradually start talking to teachers, to counselors, psychologists, speech pathologists, and then medical staff, family doctors, and psychiatrists. Let me mention that there's a lot of material on the screen, and this is for you to read and later look at the recorded presentation. We will touch on some of the issues. I'd like to focus on essentials and on lessons learned. So advocating could be an added voice at school and a community level. It could also mean contacting MPs and MPPs and getting involved at a provincial and federal level. We'll talk about it. So the typical journey, there's one more slide before this, Andrea, activities that support advocating for children and youth. So what's important is that we start recording the information and gradually present this information to the counselors at school and to professional medical staff in the hospital. It's important when your child enters a new environment, be it an emergency department or an interview with a psychologist, that there is accompanying information at hand as well, that you stand beside them and say, here are my notes. Hopefully they will be useful to you. And then you can also get into a conversation with them. You can gather this information yourself, with your spouse, with your family, extended family, neighbors, and teachers. Everybody can add to the repository of this useful material. So the typical journey starts at the very first moment when you realize that there's something wrong. And soon after, your child may be diagnosed with mental illness or maybe even be admitted to the hospital. That's the very beginning. And typically, it's a big shock because you don't think of your child presenting with mental illness. And within a span of a few weeks, typically 2 or 3 months, you get into thick of things and look up information available on YouTube and internet, talk to the counselors. And within a span of a few months, you develop some basic knowledge of mental health environment. That doesn't mean you know how to navigate it. And in hospitals and mental health organizations, there are many individuals, we call them now family navigators, new positions in hospitals, or family advisory counselors. They are there to show you the way, how to use the services, what's available, where to go, and how to inquire about them. So after that initial shock and navigation through the system, you come to face with reality. And you may think, this may never end. This may be a chronic condition. And you're going through ups and downs yourself, apart from your child and you. The whole family is going through the motion. It's important to stick together and ask for help, ask for peer support and for literature, compare the notes and ask, is this normal? How can we get through this? And there's lots of help. We will provide you with sources of information that will be useful to you. So the question is, where are you on the journey? Because depending on where you are, you will need different tools and different supports. So the initial signs of mental illness, it could be something that you consider normal, and you may not worry about it. But I encourage you to trust your gut feeling and reach out to teachers um, and compare your views with other family members and start collecting information about your child. It starts with unusual behavior and emotional outbursts and changing appetite, withdrawal, different patterns of behavior from the past. So you should be looking for changes in their environment. They might start spending more time in their own room, close the doors upon coming home from school or from other trips. They might go straight to their room, whereas typically in the past they would talk to you. And that will raise some red flags, and don't ignore them. Just ask yourself, what's going on? Perhaps initiate a conversation with your child. And they might have an explanation. It might be one of a kind, or it might be a pattern of what's going to come. Now, what should you do in such cases? Definitely don't do this on your own. Connect with other family members. It's important that you and your spouse are on the same wavelength. And when in doubts, ask experts for advice. And at work, very often there's employee assistance plan where you can connect with the experts. I remember one day I did not know what to do, and I took a day off, and here we go. I received an advice that this is what I should be doing. So try to listen more attentively, observe, definitely love them and spend time with them. The last thing we want is for a child to be left alone at times of crises. And a good starting phrase to a conversation with anyone, including your child, is to say, I have a concern. What do you think? What can you tell me? And that's how a conversation starts. So the first environment we will consider is your home. And there's some repetition of my comments on different pages of the slides, but it's intentional. Start being more engaged and gather the data from family and friends, and definitely perhaps open a journal. And after a few days and few weeks, you'll notice new patterns, and that's the information you can bring to school and talk to psychologists there. So you're looking for patterns in behavior, changes in mood, and different signals from school and from private parties. I do remember attending a family gathering, and I was stopped near the door, and one of the family members referred to my child as different, and they noticed the change before I did. So around the age of 12 to 15, it's also time to start talking about smoking, drugs, and alcohol. And I like painting hypothetical situations, like imagine you're going to a birthday party and there are no parents, and and the host, your friend, the birthday boy or birthday boy starts serving alcohol, how would you react? And it's a friendly way of initiating a conversation on the subject. Now, notice at the bottom, I talked to a psychologist at one time after a seminar on parental changes in mental health. And she said, I still need to see one teenager who would refuse a hug. So at times of difficulty or confusion, we need to be there for them and offer a hug when we spend time with them. So next is the school environment. And most schools are supported by professional student services personnel. That includes psychologists, social workers, speech language pathologists, and others. They have access to other services. So depending on your child's needs, they may refer you to specialty services. And they help families in research and access to community supports. It's definitely worth spending time with them. And here we'll touch on good advocacy. What does it mean to advocate well for your child? And when I spoke with a school psychologist recently when doing research for this presentation, she said, be proactive in communication with the school. Ask for clarification and suggestion, and be the added voice, not the voice. Or don't do this apart from your child. Have a conversation, have them join you at a meeting with the school psychologist, and clearly state your expectations when talking to professionals. Share the info that you bring from home, and be prepared to implement their advice at home, and create a bridge between home and school, and try to iron out the initial differences or inconsistencies. You can definitely use their advice at home as well. And you may talk to your child and say, look, they're telling me that we should be spending more time discussing your homework, or perhaps like in case of one of my daughters, they suggested that we move to visual learning based on psychological assessment. And this was extremely useful, and that's what we implemented at home. But advocating could be just too little or too much involvement. Parents can be very engaged to a point of becoming a nuisance. And you don't want to stand beside your child and be seen as a nuisance in front of their peers and teachers. Do not assume that what works at home would work at school equally well. There's not always that one-to-one correspondence. And don't be embarrassed or ashamed of your child or youth condition. So next is a community environment. Ideally, your child would be involved in a variety of extracurricular activities, be it sports or art or volunteering or scouting, any of this. This is very helpful, particularly at the time when your child is diagnosed with mental illness. This is providing an outlet for their creative juices, and it's very meaningful that apart from school, and home, they also attend a variety of extracurricular activities. Now, what's worth mentioning is that your child might get in contact with alcohol, drugs, or other substances, and there's no point ignoring this. I think it's safe to assume that they will all be exposed, at least visually, if not otherwise. And one statistic that I keep in mind is that every third to fifth child may be negatively affected by smoking cannabis. And most children think that it's harmless, it's available, it's no longer illegal. So that's definitely worth looking into and engaging in a conversation with them. Be a partner in decision making rather than that parent that's far removed from reality. And I do remember Steven Spielberg accepting the Guild Award some time ago, and he started his speech by saying, "I thank my parents for allowing me for a decent dose of rebellion during my early years." So yes, it is important to allow them to experience life and yet maintain that conversation with them. If you're in crises, depending on what kind of crisis it is, if you don't know how to control the situation, call 911. Ask for either medical or police support. And if you can bring your child or youth to emergency department, that's probably one of the best ways for a quick intervention. Or at least bring the child to the family doctor and then receive a referral to a mental health hospital. And you can be admitted to just about any mental health hospital with the referral from your family physician. So see what hospitals are around you and be prepared in advance. Now, I also list applying to justice of the peace for so-called Form 2 when there's a potential for harm, self-harm for the child or by the child, or harm to others. And I went through this, and it takes 2 or 3 hours of a good in-depth conversation, but it allows you to engage police at the time when the situation is drastic, and you simply ask for assistance for police to come and take your child to the hospital, or go and look for your child. If you don't know where they are, they might be missing for days and weeks, and that's one of the avenues for you to explore. I suggest that you also look into power of attorney for medical or property. Consider becoming a substitute decision maker, and be familiar with legal consent and your rights and responsibilities. All of this comes very useful at the time of crises. However, that needs to be arranged way ahead of time. So here is a list of professional resources available to you. And that includes school counselors, psychologists, psychotherapists. Typically, psychotherapists are not available in the school, but psychologists are, and speech pathologists. And in the hospital environment, you get in contact with nurses, social workers, and the entire team consists of a social worker, nurse, and psychiatrists in mental health environment. Very often, it's good to talk to your family doctors. Then they would refer you to a pediatrician or a psychiatrist. The 3 posters. I was at St. Joseph Hospital in Hamilton about a week ago, and I've seen them in the lobby, and here they are. If you've never been in a mental health hospital, it might be a good idea to ask for a family orientation, and most centers do that. There's a family peer support group meeting either once a week or once a month. And typically there's a family resource center as well, with meetings and educational seminars once or twice a month. And nowadays there's also family one-on-one peer support. So there's an increased number of supports available. These examples come from St. Joseph Hospital in Hamilton, but typically all hospitals offer such support. Here you see other means of peer support and the reasons behind it. The 2 on the left-hand side are also at St. Joseph's, and one on the right-hand side is by Parents for Children's Mental Health, an organization that you're part of. If you wish to advocate on a larger scale, and that would be in the 2nd, 3rd year of your encounter with mental health, once your personal situation is stable and your child, the youth, is looked after and possibly on medication and recovering from illness, you might want to tap into volunteering at organizations such as family councils or family advisory councils. Most hospitals have them. You can start by attending their monthly seminars, educational sessions, and learn more. We are looking for parents with lived experience from a particular hospital, whether you're a patient in the hospital or visiting the hospital as an outpatient client. It's priceless experience, and we would like to hear from you. There's lots of materials on the internet and special reports. The one on the right-hand side on the screen is a report from 10 years ago of a select committee on mental health and addictions in Ontario. And that started a new path in mental health services, and it's definitely worth reading. You can go as far as United Nations and other international bodies. I would encourage you to also tap into hospital websites. Nowadays, CAMH in Toronto or St. Joseph in London and Hamilton and Ontario Shores, in Whitby, and Hotel Dieu in Windsor, and many other places. OFCAN is coordinating all these organizations, and Royal in Ottawa as well is one of the key stakeholders among members of OFCAN. Typically, there's about 20 organizations and 50 members. On the screen, you also see FAR, which is a family addictions organization, and it's not mental health, but very close. Yes, next, please. So here you have a list of organizations other than hospitals, such as Canadian Mental Health Association and Your Parents for Children's Mental Health, CMHO and OFCAN, and Families for Addiction Recovery, FAR. There's lots. I just collected a sample for you to realize that there is the whole slew of them supporting parents in with children with mental illness. Now, family resources are available in many different ways. Typically, family centers are like libraries with staff all day long, so you can visit them in hospitals, and once a week or twice a week, they are also open in the evening. The one that I attend is at Ontario Shores, and it's Thursday night every week. And now we are opening up after a year or two of COVID restrictions. We start having those face-to-face meetings again. There's lots of newsletters, books, child and youth mental health centers, and walking services. It depends on the urgency of the situation. You can get help the same day or next day or the same week. So here we have examples from Ontario Shores. And I was piloting a family caregiver charter of rights at Ontario Shores. And it's been implemented a couple of years ago, and that tells you how important family caregivers are. It used to be that patient charter of rights was on the hospital walls for decades now, but family caregiver charter of rights, it's new. And you do have access to information, and you have a right to be part of the circle of care, and be treated with respect and understanding and utmost sensitivity. One of your rights is to be included in the process of diagnosis, treatment, and discharge planning. What's on the right-hand side is a list of educational support programs and courses. I did take a course titled Powerful Tools for Caregivers, and it typically lasts about 6 to 8 sessions once a week for a couple of hours. Recently, we had it online, but normally they are in person. You meet in a group of about 10 individuals, share the information or share the experience, and one leader is providing materials, books, and there are many advantages. You see others in similar circumstances, and you end each session on a more positive note, and you know that's not the end of the world as it might seem. So the family support went through a substantial evolution over the last 10 years. We were not included in the circle of care, but now we've moved from the fringes to mainstream, and family is now recognized as an essential part of recovery. We'll move to the next slide because I'd like to leave some time for questions. Here's the summary. Advocating for children and youth means adding a voice in their support. And we have to be engaged in the process at home, at school, and in the community. Definitely, advocacy starts at home. It takes time to talk about it and research the topic and engage your child in the process. We definitely need to do our homework before we start advocating for our children. Our comments and observations matter to schools and professionals. They often rely on it. And recently, my recent experience was only about a week ago. I was at the emergency with my child in Hamilton, writing 2 pages of notes, and I submitted them to the doctors. And about an hour later, in a meeting with us, they were quoting from my notes, which means they read them, and they were essential in the decision of keeping my daughter in emergency that night. So your advocating makes a difference. It's piece by piece. It's a slow process, but it's essential and very important. Never give up, because it could mean in the extreme, a difference between life and death. Your presence could be essential in the recovery, treatment, and admission into the mental health, and then complete recovery. By listening to professionals, we increase the chances of success. And ideally, we would not only listen, but collaborate with them and be partners in this recovery process. And it is very important that you're aware that you are the only continuous support for your child prior to admission, during the admission, and stay in the hospital, and then upon discharge and recovery. So You're a familiar face for your child. And you are absolutely vital in the recovery and maintenance of a healthy lifestyle. Your support is essential part of treatment and recovery. And I'll end it with a mural from St. Joseph Hospital in Hamilton on the mountain. This mural consists of small boxes of about 2 by 3 inches, and every piece of art is about hope. It's about support. It's about health and recovery. Thank you.